You know, we've already gone live once this week, but we're going live again. Why? Because I had 3 cases of posterior tibial synovitis on Wednesday. And they were all very much the same, and they all responded extremely well. So I wanted to share with my doctors out there specifically how to diagnose this and how to assess it. And especially because I'm getting all fired up for my Run Better, Run More seminar that goes next week in the office. We're going to talk about how to teach running mechanics, and it's for doctors, it's not for patients, but this is for the docs that want to reach out to the runners in their community, how to treat running injuries, and how to do dynamic and static assessments on runners. Enough said on that. Posterior tibial muscle runs behind the shin bone, behind the medial malleolus, and attaches back down over here on the bottom of the foot. Sarah was noticing that when we pulled her foot out this way, it was a little uncomfortable. When I had her do active posterior tibial strengthening, toe down and in for me, Sarah. Pull pinky toe down and in. That was kind of painful, but even as we extended it, it was painful, right in through here. So I thought, well, maybe we can just do some simple strengthening, pump it, maybe it's a tendonitis. How I knew it was a tendinosis, a synovitis, is because it was palpably tender right in through here as the tendon in the sheath. And when I stretched the sheath, that made it kind of mad. And she had a real problem doing the active contraction of the posterior tibial. So it's that stretching of the sheath, the tendonitis, the tendinosis, tendinopathy may not necessarily bother you, but you will get pain with active contraction. Of course, we checked the foot and ankle. She had some tightness in the in the tarsal joint in through here, the mortise joint. Subtalar joint was okay. There was some tightness in the navicular and talar joint. That was all adjusted. Treatment was very interesting. Did a little bit of instrument-assisted soft tissue mobilization along the posterior tib, okay? In the belly. This was kind of mad. This really didn't like this, so we just did a little bit of stroking, mostly for edema. If it's a tendinosis, you do this, and a lot of times they can actively contract it and there's no pain. In her case, we did this. We worked the back of the calf to loosen that all up. We adjusted the foot, and we found she still couldn't bring this in. All right? The test of choice is with a the exercise of choice is with a CLX band out here, pinky toe down and in. Go ahead, pull in. Pinky toe down and in. So that's strengthening the posterior tib down and in with the tension of the band off to the side. All right? How's that feel today, Sarah, by the way?
It feels very good today.
That feels very good today. She couldn't do that, okay, on Wednesday, so we had some fun. After we did her Graston, or instrument-assisted soft tissue mobilization, we cleaned her up. And then we took some TheraBand Exact Stretch Kinesiology tape, one of my pre-cut strips. Bring the foot up and over. Anchored it at the attachment of the posterior tib. Gave it pretty good stretch behind the medial malleolus, almost a 50% stretch using the Exact Stretch technology. And then right up the back of the leg, and then no tension at the tab. And as soon as we did that, she was able to do comfortable posterior tib exercises and resistance. Then we got out the CLX and go ahead. We had to do a couple of sets of 10 like that. So, posterior tibial synovitis, inflammation of the synovial sheath, okay, the tenosynovial sheath. I'm Dr. Donald DeFabio. DeFabio difference. Google it, check it out, it's for the docs.